Thank you everybody for being here, and I'm super happy to be here in the center of Romania. I'm here to talk about a new treatment with a specific laser with the Aviclear working on acne. Acne, as you know, this is a dermatological conference, is kind of the bread and butter of dermatology, so to say. I talked with a doctor who sees like 90% of his patients are somehow connected with acne. And we saw some great pictures here helping with acne scarring, but also, you know, helping directly with acne and having a direct approach to the sebaceous glands and having a new wavelength introduced in laser dermatology. I think this is the exciting part here of the Aviclear. So when we take a look, as I mentioned, on acne management, there is, number one, it's an extreme common disease. And this is a little bit the difference. I'm sure you have heard a lot when I take a look at the systems and when I take a look at our other systems that Cutera also has. They're very much in the aesthetic world. And what we have seen with acne, this is not necessarily an aesthetic problem. This is a disease, so that patients are coming to get help on that. When we have our patients, you know, they have a problem with their nasolabial folds, some pigmentation, some wrinkles. That is more nice to have the aesthetic world, but here we are really helping patients, and this is what we, what you're seeing here ultimately is that patient compliance is really problematic here because the possibilities that are available, yes, we know isotretinoin from inside out, but we also know about the limitations, the problems that we can see with some patients. So a new approach is needed to treat acne. And I'm saying that coming from a laser company, and we had for years systems, and you see some systems here as well, that had an approach somehow to work and help with acne. And I will talk in the next slides about how Aviclear, how this wavelength is differentiating in the approach and in the way how we can help those patients. With that, I just want to go a little bit, and I know you're all dermatologists, but still, to understand the differentiation of Aviclear, we have to take a closer look how acne is developing and what are those main causes. We know that we have, so to say, those five big points that affect the development of acne. Of course, first, the androgens, the hormones that's stimulating. Then you have the bacterium, the C bacterium, that is raising in number with the sebum overproduction. And then as a follow-up, we get the higher inflammation. And then when you have the closed hyperkeratinization, you have like this, cycle and this wheel that we want to break. And all starts with the overproduction of sebum, because that is the core problem of when you have an acne situation that we need to get under control. So here you see the pathogenesis of acne in the different developments. We can handle easily the whiteheads and the blackheads because we still have not the inflammatory reaction. We still have kind of a control over the number of C bacteria. And here comes the problem. When we have an ongoing production of sebum and there is just this traffic jam, you're ending up like we did on the traffic in front of that bridge, and we have 4 hours more traffic with piling up cars. So what we are doing is we're reducing, we want to control the sebum overproduction. So how do we do that? And just to illustrate again, yes, we have help and we have tools to work on each of those individual causes of acne and those problems, the hormones, the sebum, was still, as a only solution treated with isotretinoin. We have the retinoids and the retinols for the hypokeratinization that also for the bacteria and the inflammation. We have our different tools. And this is how we have to see the treatment of acne. Maybe one patient needs a little bit more in this field or in the other field, and not every patient from the beginning is the right patient, or it's the right severity of acne for isotretinoin. So where does Aviclear and this new approach fit? It fits right there in the sebum, because I will show you in the next slides how the physics, how this technology is working in the biology, showing where we are working with the Aviclear. So the Aviclear itself, just from a technological standpoint, it's a 1726 nanometer laser wavelength. And this wavelength is known to be 2 times higher in the absorption than water. And as you know, with lasers, we always try to follow the concept of selective photothermolysis, which means we want to concentrate our energy and the absorption, our creation of heat, in one structure. That's what we're doing with hair removal in the melanin. That's what we're doing with vascular treatment, with the hemoglobin, the oxyhemoglobin, to be really specific. And that's what we are doing with that wavelength, where we have a higher potential in the absorption. But as you know, just the wavelength doesn't define a laser. It's also very important to have enough power, because with that power, you're defining the pulse duration, how long do we heat up a structure, as well as our spot size. And the spot size, as you know, is very important when it comes to penetration depth. And Aviclear has a customized spot size and a customized pulse duration to really focus to get to the sebaceous glands itself, to get to our target structure in the first place. Because the first rule of laser treatments is you have to reach your target. That's why we are using lasers, so that we can reach deeper targets with the 1064 laser, for example, for vascular. And in this case, we have a specific laser that goes after sebaceous glands. Important point is also the cooling technology, because there is always so-called competing chromophore. In our case, it is the water. Yes, we have, of course, water in the skin. And yes, of course, there is also some absorption in the water. But to stay in our focal concentration in the sebaceous glands, we want to avoid an effect in the surrounding tissue. And that's why our sapphire cooling is so important. And what is really important for us as a company working globally for years, we want to have an all skin type solution. And this laser, thanks to the wavelength, so to say, that is colorblind, with the focal energy on the sebum, we have that. So as I just mentioned here, we have a 2 times higher energy absorption in the sebum, in the oil itself, because of that peak what we have here. When we are zooming in here with the Aviclear, the optimized selectivity, because even, just a few nanometers to the left or to the right, we would lose that selectivity. So the quality of the laser, to be really precise, to be really in that one wavelength concept of lasers, is really important with such a treatment like, focusing on the sebaceous glands. For example, with vascular lasers, there is this wide range of laser wavelengths that can have effect. So we can have kind of everything between 532 and 600-700 to be in that peak. That's why we have some IPL systems that can work on diffuse redness. Here, very specific, very narrow, this bandwidth that we have to follow. So we talked about this a little bit. It's not only the wavelength that is defining a laser. I'm always jokingly saying, when I tell you I'm riding a motorbike, you don't know what it is. You need more specifications. What's the horsepower? What kind of bike it is? And here it's the same. we have to look at all the other portions which are defined by, for example, the power, because that the pulse duration, how long do we heat up a structure to stay selective before we heat up a surrounding structure, is super important. And with that power we can have high energy levels in a very short time to really have that special effect. Another important point is the spot size, the spatial aspect, because as mentioned, we have a certain depth where our sebaceous glands are sitting, and we have to reach that to deliver our energy there. We have to deliver that energy to the target structure to have an effect there. And all of this is happening with this customized laser, with the Aviclear, where we really looked to get a specific wavelength in the specific energy levels and timing in a specific, depth. And that's actually the importance here of these systems, to really be able to have such high power lasers. And to go a little bit back to our target structure, here is what our goal is. You see here the maturing process of the sebocytes, starting from the sebocyte stem cells. They are building the wall of the sebaceous glands, and then comes this blooming, so to say, this transformation where the sebaceous gland itself becomes the lipid, becomes the oil. And where we are working now, we are heating up these lipids, we're heating up the oil and harming these connected, the yellow dots here, which are in the wall, the sebocytes that are actively responsible for that overproduction. So this is our goal. Similar like hair removal. When we talk about hair removal, we are actually heating up the hair follicle, but the hair follicle is heating up the surrounding structure, the bulge and the bulk, right? Because the hair follicle, it's a disconnected, part already, but we want to have a little bit of transmitting of that heat to structures that actually are still responsible for the production of the hair. And this is how we are doing it here as well, by selectively heating up the sebum. You see here how, after 5 days after post-treatment, how the sebaceous glands has stopped the production of sebocytes. We are not destroying the stem cells. However, these sebocytes that are actively in the maturing process, that's what we are stopping. So we are stopping the traffic jams, so to say, by reducing the amount of cars that are coming towards that traffic jam, so to say. But still, an important part is that we are seeing the treatment in the more holistic way, because we talked about those other points that are, responsible for acne, the inflammation, the hyperkeratinization, the C bacterium. We have to still take care of all those other aspects while we are reducing the core problem, the overproduction of sebum. To underline a little bit not a little bit, but the complete concept is proven by our FDA study. And I just want to go through that study, because this was really a well done study, not only by the amount of people that we had, but actually getting with the FDA in the US the approval for mild, moderate, and severe acne treatment, going directly after the sebocytes. So what we have done, we did some imagery on the baseline. I will show you a series of pictures later. The treatment itself is a series of 3 treatments, 1 month apart, right? So this is the concept of the treatment. We are treating the entire face with the laser. We have a scanner on the tip. I show you at the end. I hope we have some time, a short video, so that you have an understanding how the system looks like and how easy that treatment is, just a short one. So that we do those 3 treatments. And as you know, as you can, extrapolate out of the way we are working, we are first taking out the overproduction of sebum, but it takes some time for the situation to calm down. There is still some inflammation going on. There is still the bacteria going on. So that's what we have to take care. And that's why we need to tell our patients, you have to be patient, because those results, they sometimes take time. We have cases where the sebum overproduction was so severe and made a difference directly after first, second treatment. But actually by calming down this overproduction, it takes some time to calm down the overall situation in the face. So we did some images and some checkup 1 month, 3 months, 6 months, and then 12 months after the treatment. We had a 3 months primary endpoint in the study. And just to let you know, all the pictures that I show you, all the results that are here are monotherapy. This is not a real world approach. As I said, we have to look about the right concept, the right combination of tools that we have available to treat the full aspects of acne. This study, as we wanted to show proof to the concept, was monotherapy, so there have been no other treatments done, nothing against the hyperkeratinization, nothing against the bacteria, just taking care of the sebum, and still we had some great results. So here the demographics of the study was quite wide, and we wanted intentionally to have a very wide range. And you see here already a kind of a summary about the efficacy 3, 6, 12 months after the treatment. So we had a 1 grade improvement nearly after. This is the 3rd month, the 2nd month, and the 1st month. We had 88% of all our patients had a 1 grade IgA improvement, and already 93%. And a 2 grade one was already, you see that time is our friend. After the 1st month, we had 46% of all the patients have shown a 2 grade improvement, and then 73% a 2 grade improvement after 3 months. And that is ultimately, you see also the different ways to take a look at the same patients. Here you have clear to almost clear. Here you have the ILC count, the improvement there. And the bottom line of that data is that patients that are coming to you with a severeness level, and you're telling them, I can help you 1 or 2 grades, this can, make the world for them, because you have to understand their psychological problems, how often, how long they've been through cycles of acne treatment, maybe the 1st, 2nd round of isotretinoin not working, or just not willing to do so. We have very often in Germany at meetings like that, and other meetings, there is kind of a, let's say, a drawback to fillers and going all natural. And so a lot of people kind of refuse the isotretinoin, even when it's a low dosage, which is very well tolerable, reducing those side effects and very well known as well. But we have a bigger community coming to our doctors saying, listen, I want to have a direct approach on my problem. Why should I take a systemic drug? So this is the goal, what we have here with the system. When it comes to the results, when it comes to safety, these are the, so to say, expected laser results after the laser treatment. We have some erythema, we have some edema that is just, staying for a couple of hours sometimes, or max will stay a day or something. We have some flare-ups in this monotherapy study that was done in the US. So we have this high number of 44%. You know that when you are going an isotretinoin round, you also see this flare-up, which means you have it's getting worse before it's getting better. And these flare-ups are actually a very strange thing when you look at it on a global scale. We have in the US, where the study was done, we have kind of this average between 35 and 40 in real life. But I was a couple of weeks with Dr. Wahn from Germany. He's in Hanover. He has over 160 treatments done. And he says, I rarely see them. When he was like thinking about, he saw 2 flare-ups. This is real-life dermatology where he's taking care of all other aspects. And I think it's also because what we learned as a company, what we learned from our dermatologists, from our partners, of course, is acne is complicated. Acne can be, triggered by everything: your environment, your stress, your diet, your, hormonal level. Everything can trigger acne. And so it's, I think, worth to think about what is the difference when in the US patients come and they have a high flare-up, or in Germany or in Europe where there is a different diet, where there are different creams, they're different, and it's a different environment ultimately that eventually could or could not trigger those flare-ups. But again, this is monotherapy, and in the monotherapy, I take it, we have with those other aspects that I listed already in the fight against acne, we have points to help our patients so that we are, reducing those flare-ups. However, talking about a flare-up, I show you some pictures later, is not a bad thing, because when you have a control and you are telling your patients, this is what we expect, it's getting worse before it's getting better, that's all we need, having your patient and to guide the patient. We talked by length about this. Most of them happen directly after the first and second treatment. Rarely they are happening later. So it's a direct effect to the treatment, so to say. One doctor, he said, I'm explaining it my patients, well, we are stopping the sebum production, but still that sebum has to get out, right? So we have to clear that out. With hair removal, I'm very often referring back to hair removal because we have a similar phenomenon sometimes. After we do a treatment, the hair follicles, sometimes when we do especially NDIAC treatment or IPL, where we are not like with the alexandrite, blowing the hair out, when it sticks in there, it's a dead hair. So the body needs to push it out. And sometimes patients coming back saying, hey doctor, what have you done? I have more hair growth. No. These are, a doctor called it zombie hair. This is the dead hair that needs to push out. It looks for the moment a little bit worse than it's getting better. And I think this is very close in the explanation for our patients to calm them down and to control that aspect. So this is a typical way, or this typical flare that we are seeing here in this patient, so that we are having, and again, this was a patient of the study. All the patients I'm showing you the pictures, they are from that study. Some are from later on with ongoing pictures. But what you're seeing here is that, yes, we're talking about a flare, but we can control situations like that. The patient, she has seen situations like that, but then appreciating the progress after the 52 weeks. So when it comes to patient comfort, yes, it's a very high intense laser. And as I mentioned, we are 2 times higher in the absorption coefficient of the oil rather than the water, but still there is some, beg your pardon, there is still some energy that is taken by the water, which can cause some sensation and some pain. With our active cooling, with our technique to water the surface so that we have some cooling and some very close contact to really push that energy inside so that we are not having too much reflection and scattering on the surface, we really can, our patients can tolerate that. The most difficult patients obviously are those, 17-year-old teenage boys that never have had an experience. And I can tell from my own youth, yes, it was, pain sensation was not my thing. So you have to see your patients. When you have patients that get their kind of later in life, in their 30s, women that get in their 30s, 35 years, again acne, and coming to you and say, listen, I've been there, I don't want to do that again. They tolerate that fine. So it's really something that you can really tolerate fine. Because this is the goal. We want to have that high patient satisfaction. And again, time is our friend. Over time, we have Dr. Wahn. He said, I see my patients in a routine. My team sees them just to have the pictures done, but I tell them they will not get an appointment for any treatment. It takes some time for the skin to clear out all the problems so that we are down-regulating the skin, the sebum production. Here you have the summary after 1 year outcome. Again, I'm throwing at you a lot of numbers, but it's just showing how excited this is, because this is in ranges that only ISO was able to treat there. So here you see some treatment results. We have here the baseline with 6 months after the third treatment on a Fitzpatrick 2 skin type, Fitzpatrick 3, 4, 5, and 6. So again, we can treat all skin types with the device, and that's actually a great improvement, which means when you don't have the darker skin types, which means also this is an all-year-long treatment. We don't need to wait for the laser season in winter when people are not going to the sun. So here are some cases in detail where we have the baseline, the 6 months and the 12 months after. I'm clicking through some of the cases, because even maybe there is something left, I'm pretty sure you have some more treatments in your portfolio to help to take it from there. Again, these are all monotherapy. So when you think about, we just heard about possibilities with acne scarring, improving the skin overall tone and texture. I think, in combination with such a core treatment, we can help our patients tremendously. A patient coming from here, even, yes, there are here and there some spots. It's not about getting clear, supermodel skin. It's about the IGA improvement 1 or 2, where we really give a relief for our patients. So a patient that over time has struggled with that for long will be thankful, and you're giving you have something new in your toolbox. LiDAR types, yes, there can be some other areas, there can be some recurrences. We are seeing now, with experience after 2 years, I will show you some pictures. We have some cases where it's kind of down-regulated for good. We have other situations where here and there, maybe hormonal pushed again, where something, some spots are coming back or some new spots developed. I would say it's more new spots developing, where we can have eventually another treatment over some time, like a touch-up treatment, but very rarely. So here, a severe case like that, where you also have, the pain sensation by contact. I think this gentleman will. Here you see the full follow-up baseline after the second treatment, third treatment. It takes time, and this is the important thing. We are taking away the root cause, the overproduction of sebum, and then let the skin do the magic, so to say, let the skin clear up. We can support the skin with other treatments, with other laser treatments that work on the hypokeratinization, reducing the bacteria count, helping with the inflammation to get that out, and we can have great results here. So this is one of our longest long-term treatment results models. We had, this is actually one of our engineers in the office in San Francisco, and he was one of the first guys treated in the study as well, and ultimately after 4 years still having these almost clear results where he can easily handle the situation compared to what it was before. And this is what we are aiming to really down-regulate this overproduction of sebum, to down-regulate the situation in the skin to have that. So here, some of the key takeaways with this new wavelength, 1726 nanometer, in combination with the contact cooling, because it is important to see the system as such, not just a wavelength, but as a system, including the cooling, the spot size, the scanner, everything what you see in the short video, how the system is working in conjunction to really get to that results. The energy delivery is directly at the spot where we need to be. And, you know, we can work from severe, and it's best working actually on the severe inflammatory acne, so that we can help patients in those situations, in active acne situations. It's working on all skin types. The results, time is our friend, continue to improve. It's perfect in real life for combination treatment to whatever you have seen as technologies, whatever you have seen as solutions here and here at this Congress. We have the long-time studies to prove and show that this is the right way to go directly after the sebaceous glands itself, so that we are getting that high patient satisfaction. So, one thing, as I just mentioned, the top concerns of our patients are the acne-prone skin, the sensitive inflammatory skin, aging skin, large pores, dull skin. When you're starting with a patient here, this is a patient for life. When you have a patient and you are helping him on the active acne situation, they have the trust and the starting point for all those follow-up treatments. If it's diffuse redness, pigmentation, the acne scarring, overall, we had a doctor telling us, I like when the moms bring their sons, because the moms become the patient next time for a different treatment, because you're building trust. You're in, let's say, without, you know, being unrespectful, in real medicine. We have a doctor in Turkey, Dr. Aviclear. She is, so to say, the syringe queen. She's very famous in Turkey with her syringe. She's doing a lot of fillers. She bought the Aviclear because she said, I'm a dermatologist, I suffered myself. This is something coming from my heart, for my heart, being back in dermatology, helping patients. And so she's doing that, and she's, you know, bringing new patients into her clinic thanks to offering acne. And this is what I'm saying. You have to a complete journey of patients. Yes, you're starting here, but then you have all those other concerns and conditions that you can take and can take care of. So just to finalize, I hope I was not too long. My lecture, I just want to show this short video here, if it's running. Yeah. This is the system, the handpiece with the contact cooling handpiece, where you have a pressure sensor and a contact sensor to ensure that you are in the right space, in the right contact of the skin. You have the sapphire window, you have, it's a very short one, sorry. We have a little bit more time. However, there is a scanner in the middle that is firing 7 times a 3 millimeter spot, which covers that 1 centimeter area, so that you have like around 250 to 300 shots on the full face. You're watering the skin just for patient comfort, but also to even out the irregularities on the surface. When we talk about other lasers, you're working with gel, with ultrasound gel, or with aloe vera gel. That would be too thick for this. We just need a very thin layer to even out, so that we have the optimal penetration of the laser beam without reflection in the cracks and irregularities. So with that, if you have some questions, we are here for some time, and I want to thank you for your for listening to the presentation and having me. Thanks again.